lower parts of the body. Whilst the veins will carry deoxygenated blood back to the heart for it to be oxygenated. And all these are important roles of these vessels. So if you have a damage to the vessels, you have an occlusion within the vessel, you have an issue with the valves and all that, it can impede blood flow to these extremities. So it can affect the role of the arteries and the role of the veins. And you know that the veins are able to carry blood back to the heart with the aid of these valves. We realize the veins are doing it against gravity. So it's very difficult to push blood against gravity back to the heart. So there are these structures within the veins that prevent backflow of blood in the veins. And these are what we call the valves. So that is one difference between the arteries and the veins. Arteries do not have valves, but veins have valves. All right. Now let's delve into peripheral artery disease. So when you have an issue with the arteries, being it an occlusion, being it damage to the vessel, or being it vasospasms, can affect perfusion to the extremities. And this is very important because that blood the arteries are carrying is oxygenated. And you need oxygen for a lot of things. And aside the oxygen that is found in the blood, you need nutrients. So all these are very, very important things to take note. So let's look at the causes of peripheral artery disease. So what are some of the causes of peripheral artery disease you know? Can anyone tell us any cause of peripheral artery disease? So when you look at the causes of peripheral artery disease, there are two main causes. The two main causes are atherosclerosis. So you can have atherosclerosis or you can have vasospasms. So these are the two main causes of peripheral artery disease. Atherosclerosis and when we say atherosclerosis, what does it mean to say atherosclerosis? Who can explain it to us? Anyone to explain atherosclerosis? So basically, when we talk about atherosclerosis, we are talking about the formation of plaques within the arteries. And for plaques to form, usually what happens is, you know, the arteries are made up of the endothelium. And this endothelium, there are layers of the endothelial lining of the arteries. So the innermost layer being the tunica intima, followed by the tunica media, and the outermost being the tunica externa. These are the layers that form the inner lining, that form the lining of the arteries. The innermost being the tunica intima, followed by the middle, which is the tunica media, and the external one is the tunica externa. So what happens is, hypertension, dyslipidemia, diabetes, and all that. These conditions can cause damage to the endothelial lining. So they can cause shear stress on the endothelial lining wasn't damaged. Once the endothelial lining has been damaged, it exposes another layer beneath the vessel, which is the collagen. So there's damage to the endothelial lining, exposing the collagen. And once there's collagen being exposed, what happens is we have a lot of these fatty materials being deposited around the damaged area. So you can have fatty materials being deposited. These fatty materials are usually called fatty streaks. So that is the name given to these fatty materials that are formed at the damaged endothelia. And once you have these fatty streaks are atherogenic. They cause the release of a lot of inflammatory mediators. So you have the release of cytokines, interleukins, tumor necrosis factor, and all that. So you have a lot of inflammatory mediators migrating to the site. You also have platelets aggregating to the site. Once you have a lot of platelets aggregating to the site, they sort of form a clot around the damaged area. And this clot is finally stabilized by a fibrin mesh or a fibrin strand that makes the clot very hard or very resistant. Once you have that, it becomes or it sort of occlude the vessels. And if this continues and the risk factors are not managed, like the dyslipidemia, the hypertension, eventually you may have a total occlusion or a partial occlusion of these vessels. And these are what we call the plaques. So the plaques are basically atheromas that are formed within the vessels and they are stabilized by a fibrin mesh. And once you have the fibrin mesh being stabilized on the clot or the atheromas that are formed, we call them plaques. And these plaques can easily be ruptured. So you can have some being ruptured and you can have other ones being very strong and irresistible to rupture. And all these are caused by certain risk factors. So atherosclerosis is the main driver for peripheral artery disease. So when you have plaques forming within the vessels, they reduce perfusion to the extremities, and that can cause what we call peripheral artery disease. So some of the risk factors I've already mentioned for atherosclerosis. We can have uncontrolled hypertension, which is one of the major risk factors in our part of the world. We could also have diabetes.
Dr. Ishak, please,
Hello,
your voice sounds far away.
my voice sounds far away. Can you hear me?
Yes,
Hello,
please, I can hear you, but it's quite difficult to. It sounds very faint.
is it from your end or everyone is having the same issue?
Please, I think we are all having that issue.
Hello,
Please,
is
we are.
everyone hearing me or you can't hear me?
Please, I can't hear you too.
You can't hear me, but you're responding. Wow. So what's happening?
It's sort of faint, so it's like your voice sounds far away.
Okay, so I'll try and speak louder, but I'm actually speaking louder. I don't know if it's from my end or from your end, but I'll try and speak for everyone to hear. So what I'm saying is atherosclerosis is the main drive for peripheral artery disease. And we are saying that for atherosclerosis to start, you should have certain risk factors. And some of the risk factors we are saying are uncontrolled hypertension, diabetes, dyslipidemia, and smoking. All these are risk factors for atherosclerosis. So when you're asked what cause of peripheral artery disease, the cause is either atherosclerosis or vasospasms. So it's either there's an occlusion within the vessels or the vessels are constricting, which is reducing perfusion to the extremities. So when you look at the lumen, it's either something is blocking the lumen of the vessel or the vessel is undergoing vasoconstriction, for which reason perfusion has reduced to the extremities. So these are the causes. So what I was trying to tell you are the risk factors. So for risk factors for atherosclerosis, they are saying you could have diabetes, you could have dyslipidemia, uncontrolled hypertension, and smoking. The other thing is for vasospasms. So for vasospasms, is it Benita? Is that from your end? Okay, so let's move on. Yeah. Yeah, I'm listening. No, in the beginning I said I don't share slides. So whilst I'm speaking, you have to be making down your own notes.
So please,
Okay.
why don't you share slides?
Because I don't have slides.
It makes it difficult to follow.
Yeah, so I don't have slides. That's why I'm asking you to follow through. All right, so I was talking about vasospasms. So for vasospasms, basically we said whenever there's constriction of the vessels, you can have reduction in blood perfusion to the extremities. And vasospasms are usually triggered. So in terms of peripheral artery disease, majority of the cases is atherosclerosis, but very few cases can be vasospastic or caused by vasospasms. And these are usually triggered. So some of the triggers could be, so one of the major causes of these vasospasms is Raynaud phenomenon. So there is this condition we call Raynaud phenomenon or Raynaud disease. So for Raynaud disease, basically what happens is when there's exposure of the extremities to very cold temperatures. So those who live in the temperate regions around winter, you realize that most of them try to wear protective clothing. They wear a lot of socks, a lot of gloves, just to protect the extremities. Because what happens is when there's exposure to very cold temperatures, you can have vasoconstriction at the extremities. And these vasoconstrictions at the extremities impede or reduce blood flow to the extremities. And once this prolongs, it will start as it will start with either ischemia that is leading to infarction. Because when you have ischemia, which is reduction in blood perfusion, if it prolongs and nothing is done about it, what can happen is the extremities will start dying off. So it can lead to dead tissues at the extremities. So that's what we call infarction. So for Raynaud phenomenon, usually this is triggered by exposure to extreme cold. It could also be triggered by stress. So it could also be triggered by stress. And when there's stress, there's release of these catecholamines. And these catecholamines can cause vasoconstriction at the extremities, causing reduction in blood flow to the extremities that can potentially lead to infarction. So when you asked about the causes of peripheral artery disease, it could either be atherosclerosis, which we just explained, or it could also be caused by vasospasm. And a common example is Raynaud phenomenon. When there is exposure to extreme cold and stress, it can lead to vasoconstriction at the extremities. Any questions? All right, so let's move on. So let's quickly talk about peripheral venous disease. So we said peripheral artery disease, when there's an issue with the arteries, usually either an occlusion, which is caused by atherosclerosis, or vasoconstriction in the arteries, usually caused by conditions like Raynaud phenomenon. For peripheral venous disease, this is basically when you have issues with the veins. And before we started talking, realize that the veins play a role in carrying deoxygenated blood back to the heart. And this is against gravity and is done with the aid of the valves. These valves are there to prevent backflow of blood within the veins. So what happens is, for peripheral venous disease, we are looking at any condition that causes damage to the veins, the valves, or the walls of the veins. So any condition that causes damage to the veins, the valves, or the walls of the veins. So when you have a condition like, say, DVT, DVT is basically having a clot within the veins. Once there's a clot within the veins, it can impede blood flowing from the veins to the heart. So when you have any occlusion within the veins, it can affect blood flow back to the heart. If you also have any condition that causes damage to the valves, it can also affect blood flow back to the heart. So typically, we look at the causes based on what damage they are doing to the veins. So if you look at occlusion within the veins, you can have DVT in there. At times too, you can have SVT. SVT is superficial venous thrombosis, and DVT is deep vein thrombosis. So anything that affects the veins, being it the superficial veins or the deep veins. So if you have issues with occlusion in the superficial or the deep veins, it can affect venous return or blood returning from the veins to the heart. You could also have damage to the valves. So when you have damage to the valves are there to prevent backflow of blood back to the lower extremities. So it's supposed to help propel blood from the lower extremities to the heart. So what happens is when there's damage to the valves, blood tend to pool at the lower extremities. And this can cause pedal edema and all that. So we look at conditions that cause damage to the vein valves. Can anyone give us a condition that can cause damage to the valves? Any condition you think can cause damage to the valves? So we have this condition we call chronic venous insufficiency. So chronic venous insufficiency. So for chronic venous insufficiency, what can happen is this is a chronic condition where there's continuous or constant damage to the valves. They become overstretched such that it should get to a point in time the valves are not able to be competent enough to prevent blood pooling at the extremities. So with constant or chronic damage to the valves, they tend to become overstretched. Then when we look at damage to the vein walls, those at ONG, you realize that most of the pregnant women, when you look at their lower legs or their lower limbs, what you realize is there's this rope-like vein around their legs. And this is what we call varicose veins. So varicose veins, what happens is you have a lot of blood pooling within the veins and they cause damage to the walls of the veins. So because of the increased pressure within the vein walls, they tend to dilate and they form this rope-like structure around the lower limbs. So when you look at the lower limbs, you realize these veins are overstretched and they are dilated, making them very visible on the lower limbs. So that is what we call varicose veins. So these are usually the causes of peripheral venous disease. So you can have DVT or SVT causing occlusion within the veins. You could also have chronic venous insufficiency causing the vein and the valves to be overstretched, and that can cause damage to the veins. Then you could also have varicose veins where the vein walls becomes dilated and they form a rope-like structure around the legs. So that is what we call that. Also, that all these are causes of peripheral venous disease. So SVT, DVT, chronic venous insufficiency, and varicose veins. Any questions, or we can continue? All right. So what are some of the risk factors for peripheral venous disease? Looking at some of the causes, we've talked about SVT, DVT. We've talked about chronic venous insufficiency, varicose vein. What do you think will be some of the risk factors for these conditions?
Hello, Doc.
Yeah.
I think pregnancy and obesity can be risk factors.
Yeah, so that's very true. So pregnancy, obesity are major risk factors for peripheral venous disease. So what happens is anything that is putting pressure at the lower extremities can potentially cause peripheral venous disease. So when you look at pregnant women, because of the pregnancy, the distended abdomen, this can put pressure on the veins that are supposed to return blood. They can compress on the veins that are supposed to return blood back to the heart. So you can have blood pooling at the lower extremities. So that is one of the major risk factors, pregnancy. You could also have obesity that can also cause blood pooling at the lower extremities because of the stretching and damage to the veins. What again?
I think he
Hello. Hello.
Yeah.
You can also have, let's say, stroke patients who are bedridden or patients who are bedridden in general.
Okay, so that would be more of a risk factor for DVT. So if you
Yes.
are bedridden, yeah. So if you are bedridden, looking at the virtuous triad, we'll talk about it more in DVT. But when you look at virtuous triad is basically a constellation of three things. So you can have venous stasis, you can have hypercoagulability, and you can have endothelial injury. So if you are bedridden, usually for more than 3 days, you are at risk for DVT because of blood stasis. Blood is stagnant for some time and it can potentially lead to clot formation. And that will be a risk factor to developing DVT. And once you develop DVT, that can predispose you to getting peripheral venous disease. Okay, what again?
Hello, Doc.
Hello.
Hello.
Yeah, so diabetes can actually do that. Just that diabetes tend to do more of the arteries. It tends to do more of the atherosclerotic conditions. So it affects more of the arteries, but it can potentially increase your risk for peripheral venous disease as well. Any other?
I also believe that age can be a risk factor.
Hello, I can't hear you.
I also believe that age can be a risk factor, but that one is more
Yeah,
to do with
age.
age.
Yeah, so advancing age. Once you are increasing in age, your risk for developing peripheral venous disease also increases because the veins and the valves become very weak. And once they become very weak, they can't help return blood easily back to the heart. So you can have backflow of blood to the lower extremities, causing blood pooling. So advancing age is also one of the risk factors. So all these are risk factors. And usually females on contraceptives. So oral contraceptives to predispose you to getting peripheral venous disease. You know, it even increases your chances of getting DVT because it increases the procoagulant factors and all that. So all these are risk factors for developing peripheral venous disease. All right. The other thing I want us to talk about is this condition that can cause both peripheral artery disease and peripheral venous disease. And this condition is what we call the Buerger's disease. So Buerger's disease. I'll type it in the chat box. The other name is thromboangiitis obliterans. So that's the other name for Buerger's disease. Thromboangiitis obliterans. So this condition can actually cause both peripheral artery disease and peripheral venous disease. So what happens is this condition is, so looking at the name thrombo means clot. Angiitis means inflammation of the vessel. And obliterans means occlusion or obliteration of the vessel. So what happens is there's formation of a clot and there's also inflammation of the vessels, for which reason the vessels becomes narrowed. So you have inflammation, you also have clot formation, and all these can narrow the vessels. And Buerger's disease is usually associated with heavy smokers. So those who are chronic smokers and those who are engaged in heavy smoking, they are usually predisposed to getting Buerger's disease. And it affects both the arteries and the veins. So Buerger's disease affects both arteries and veins. And it causes occlusion within the vessels and also inflammation within the vessels. Okay. Any questions before we move on?
Sir, can you please take it again?
So I said Buerger's disease is also known as thromboangiitis obliterans. So if we break it, what it means is thrombo means clot, angiitis means inflammation of the vessels, obliterans means occlusion or obliteration of the vessel. So what happens is this condition can affect both arteries and the veins. And we are saying this is usually associated with those who are heavy smokers or those who are chronic smokers. So what happens is that you can have inflammation of the vessels, and that can lead to clot formation. Once you have clot formation within the vessels can easily be occluded. So that is what we call thromboangiitis obliterans or Buerger's disease.
Thank you, sir.
Okay. So you go through what vessels stand for. So each letter within the vessels stands for something. And that is what we are going to use to clinically identify peripheral artery disease or peripheral venous disease. Because you can be in the party and someone walking, telling they're feeling pain within their legs, and you can't tell whether it's the arteries or the veins. So once you're able to go through the vessels, you should be able to identify that this is peripheral artery disease or that is peripheral venous disease. Okay, so let's start with the first letter. So the V there stands for various position. So various position. And this various position, we are looking at two main positions. So we are looking at one, the dependent position. So dependent position. And the second one is the elevation position. So we should be able to differentiate peripheral artery disease from peripheral venous disease based on the position that helps alleviate the pain within the legs. So these positions are two. It's either you have elevated your legs above your heart level. So picture the patient as lying supine in bed. So if you elevate your legs above your heart level, that is what we call elevation position. And if you keep your legs below your heart level, so if you are in a bed and you dangle your legs or you keep it below your heart level, you call it the dependent position. So you differentiate peripheral artery disease from peripheral venous disease using one, the various position, in which we are saying the elevation position or the dependent position. So looking at peripheral artery disease, we said peripheral artery disease, there's an occlusion within the arteries or there's vasospasms within the arteries. And for that matter, blood is not getting to the lower extremities. So if blood is not getting to the lower extremities, essentially what will happen is There's also reduced oxygen supply. There's also reduced nutrient supply. And if you have reduced oxygen supply, that can cause ischemia. And that ischemia, if it prolongs, can potentially cause infarction. And the patient will be feeling pain in the legs because of ischemia. And when there's ischemia, what happens is there's release of this substance called adenosine. So whenever there's ischemia to any part of the body, there's release of adenosine. And adenosine is what activates the pain signals to cause the pain the patient will feel whenever there is ischemia. And peripheral artery disease is equivalent to coronary artery disease, just that for coronary artery disease, there's a plaque within the coronary vessels that supply blood to the heart. So what happens is when there's a plaque in there, there's reduction of blood flow to the heart muscles, and that can cause ischemia. If the ischemia is not managed, can cause infarction. So whenever there is ischemia in the heart muscles, there's release of adenosine. Adenosine activates the pain signals, causing the patient to feel the angina pain they complain of. It's the same thing that's happening in peripheral artery disease. Whenever there's ischemia, there's release of adenosine, and that activates the pain signals, causing the patient to feel pain in the ischemic regions. So, looking at peripheral artery disease, do you think the pain will be relieved when the patient elevates the legs, or the pain will be relieved when the patient dangles the legs below the heart level? What do you think? So picture the patient as lying supine in bed. If you are lying supine in bed and you are having reduced perfusion of blood to the extremities, do you think the pain you are feeling will be reduced when you elevate your legs from the bed, or you keep your legs below the heart level, which is below the bed, or you dangle your legs to allow perfusion? Which one do you think would alleviate the pain? Anyone?
Dangling the legs below the heart.
Exactly. So you are having reduced perfusion to the extremities. So whenever you dangle the legs below the heart level, essentially what you are doing is you are helping with blood flow to that part of the leg. Once blood flow is restored in a certain amount to that part of the leg, the pain that you were feeling previously will be reduced. But if you should elevate your legs above the heart level, what happens is blood would need to move to the extremities against gravity, because now the legs are elevated above the heart, and the heart has to pump to those parts against gravity. And that takes a lot of work. That will also cause reduced perfusion to that part. So the pain is worsened whenever the patient elevates the legs, but the pain is relieved in the dependent position. And this is for peripheral artery disease. So looking at peripheral venous disease, the issue is that the veins are not able to return blood effectively back to the heart, for which reason you have backflow of blood within the veins, and that is causing pooling of blood at the lower extremities. So the patient will start having edema of the legs, they will start complaining of pain. So looking at this scenario, what do you expect to happen when you elevate the legs? Do you expect the pain to be relieved or the pain to be worsened? And whenever you keep the leg in the dependent position for peripheral venous disease, do you expect it to be worsened or to be relieved? Anyone trying?
Hello, sir.
Yeah.
Please, I'm a bit confused right now. The previous one you're talking about, was this the peripheral artery disease or the peripheral venous disease? Which is which?
So peripheral artery, but now you're talking about peripheral venous. So we said for peripheral artery, when you keep the legs in the dependent position, where the legs are below the heart level, it allows blood to flow to the extremities. So the pain is relieved. But the moment you elevate the legs, that will mean that the heart would have to pump against gravity. If you are lying supine in bed and you've elevated your legs, the heart would have to pump against gravity, and that will further reduce perfusion to the extremities, and that can worsen the pain. So for peripheral artery disease, pain is worsened when the legs are elevated, but pain is relieved when the patient keeps the legs in the dependent position. So that was for peripheral artery disease. I'm asking the same question for peripheral venous disease. Do you expect the pain to be relieved in the elevation position, or you expect the pain to be relieved in the dependent position? Anyone?
Hello. Yeah.
So,
With peripheral venous disease, pain will be worsened in the dependent position. But when you are in the elevation position, the pain will be relieved.
Exactly so. So for peripheral venous disease, the issue is blood is finding it difficult to return back to the heart. So if the patient is lying on the bed and they elevate their legs, what that means is the blood will now be flowing towards gravity. So gravity would help the blood return easily back to the heart, and that would relieve the pain the patient was having. But the moment the patient dangles the legs or keeps the leg in the dependent position, what will happen is that blood will further pull to the lower extremities and the pain will be worsened. So take note of the difference. For peripheral artery disease, pain is worsened in the elevation position. Pain is relieved in the dependent position. And that is opposite for peripheral venous disease. For peripheral venous disease, pain is relieved in the elevation position, but pain is worsened in the dependent position. Is it clear?
Yes, please.
Okay. So that is for the first letter, which is V, various position. The next letter is E. So we are talking about the vessels. I said we are using the mnemonic vessels to talk about the clinical presentation. So we've talked about the pain and how it's relieved in the various position. The next thing is E. E stands for explanation of the pain. So how the patient will describe or explain the pain to you. So E stands for explanation of the pain. So for peripheral artery disease, usually the patient complains of a sharp pain, and that sharp pain would usually be worse at night. So they usually complain of a sharp pain that is worst at night. They may also complain that, oh, initially they could walk from, say, faculty to tech junction without feeling any pain in their legs. But nowadays, they realize that when they walk from faculty to, say, maybe Agric Junction, or maybe, so let's use Agric Junction or Botanical Gardens. They realize they started feeling pain within their legs. So in terms of the distance they can walk before starting to feel pain in their legs, realize that for peripheral artery disease, you walk for a short distance and all of a sudden you are feeling pain in the legs. This is because when you look at, so it's just like MI or coronary artery disease, where you talk about myocardial oxygen demand and myocardial oxygen supply. So if the supply is reduced and the demand goes high, the patient will start having angina pain. The same way for peripheral artery disease. If the patient is at rest, in terms of oxygen demand, the patient requires very low oxygen demand. But when they start walking, when they start exercising, so during exertion, what happens is the muscles start to demand more oxygen because now you are exercising the muscles. When they are at rest, their oxygen demand is very low. But the moment you start exercising, they will need more oxygen. And what happens is, for peripheral artery disease, there is an occlusion within the artery, and that is reducing perfusion, for which reason oxygen is also reduced to that part. So you start walking for a short distance and realize that you are feeling pain because now the oxygen demand has gone up and the supply has reduced because there is an occlusion, and that occlusion is reducing supply to that extremity. But if you are at rest, the oxygen demand is very low, so you may not feel pain. The pain will only come during exertion. And once you rest, you realize that the pain is relieved. So that is what we usually call intermittent claudication. So that's the term given to that, intermittent claudication. So pain in the legs or the pain in the extremities that occur on exertion and